The fluorescent lights hum through the night. St. Mercy Trauma Center never sleeps. The air hangs thick with antiseptic and burnt coffee. A cart rattles past the nurse's station. Someone laughs, sharp and overtired. The break room door swings open and closed, a rhythm older than the building itself. Margaret Lawson wipes down the medication cart with steady hands, 72 years old, silver hair pulled back tight, wire frame glasses slipping down her nose, scrubs 2 sizes too big, name tag clipped crooked. Her movements are precise, methodical, invisible. She has been doing this for 6 hours. Not triage, not patient care, cart duty. The work no one else wants. The work they give to volunteers who cannot keep up anymore. She inventories the medications, restocks the drawers, logs the counts, locks the cabinet. No wasted motion, no hesitation. Her hands move like water. At the nurse's station, Jessica Torres leans against the counter, scrolling her phone. 29, trauma nurse, confident, loud enough to be heard over monitors and chaos. Her voice carries. I'm just saying, if she can't handle a level 1 trauma anymore, maybe it's time. Dr. Aaron Pembroke does not look up from his tablet. 34, third-year resident, tired in the way only residents are tired. She's been here longer than the building. Hospital won't fire her. Jessica shrugs. Yeah, well, she shouldn't be touching patients. Last week she couldn't even start an IV on a stable admit. Took her 3 tries. Margaret passes behind them, pushing the cart. The wheels squeak. Neither stops talking. Neither looks at her. She does not react. She keeps walking. Down the hall. Past the supply closet. Past the trauma bays. Invisible. She reaches the medication storage room. Pulls the door open. Steps inside. The shelves are stacked floor to ceiling. Lactated ringers, saline bags, antibiotics, sedatives. Everything labeled, everything logged. She reaches for a box on the top shelf, pauses, adjusts her stance, shifts her weight with the kind of efficiency that looks accidental. The box comes down smooth, no strain, no struggle. She stacks 6 bags on the cart, perfect alignment, perfect balance. Jessica walks in, sees her lifting. Oh, Marg, don't worry about the heavy stuff tonight. I'll get someone from day shift to handle it. Patronizing, kind. Margaret nods. Appreciated. Jessica leaves. Margaret finishes the restock in 40 seconds. She moves to Trauma Bay 3. Post-op observation. 31-year-old male. Motorcycle versus sedan. Stable after splenectomy. Sedated. Intubated. Ventilator cycling soft and rhythmic. Margaret checks the IV line. Flow rate. Bag volume. Connection secure. She glances at the monitor. Heart rate 94. Blood pressure 118/72. Oxygen saturation 97%. Her eyes linger on the waveform. Just a second too long. Then she adjusts the pillow under his arm. A gesture. Small. Human. No one sees it. She pushes the cart back into the hallway. The fluorescent light flickers overhead. The wheels squeak in rhythm with her steps. She stops. Her right hand moves to her left wrist. Touches the underside, a habitual motion, unconscious. There is a scar there, thin, precise. Old enough to have faded, but not enough to disappear. She exhales, keeps walking. In the break room, Pembroke pours another cup of coffee. Jessica sits at the table, scrolling through her phone. You think she was always like this? Jessica asks. Pembroke shrugs. Who knows? Maybe she was good once. People get old. Skills fade. Jessica nods, but something in her expression shifts. Doubt. Or maybe guilt. She just seems, I don't know, like she's going through the motions. That's what happens when you stay too long. Margaret stands outside the door, listening. She does not go in. She walks to the staff locker room, opens her locker. Inside a small bag, a change of clothes, a water bottle, and clipped to the inside of the door, a photograph. Younger, uniform, desert camouflage, a group of Marines standing in front of a medical tent. Dust in the air. Sun-bleached and faded. She stares at it for 3 seconds, then closes the locker. At the nurse's station, Margaret logs the medication count, signs her name at the bottom of the sheet. Her handwriting is steady, controlled. Jessica walks past, glances at the log. Thanks for finishing that, Marg. You're a lifesaver. Margaret nods, says nothing. Jessica does not notice the way Margaret's hand tightens on the pen, the way her jaw shifts, the way her breathing slows, just slightly. She does not notice because she is not looking. No one is. Margaret sets the pen down, walks toward the exit. The automatic doors slide open. Cold air rushes in. The parking lot is empty, except for a few scattered cars. She stops just outside the door, looks back at the building, the lights, the noise, the controlled chaos that never stops. She has been here for 3 years, and no one knows who she is. No one knows what she has done. No one knows what she is capable of. She pulls her jacket tighter, walks to her car, sits behind the wheel, does not start the engine. Her left hand rests on her wrist again. That same unconscious motion, fingers tracing the scar. She closes her eyes, counts backward from 10. An old habit, a survival mechanism. When she opens her eyes, the hospital is still there, glowing in the dark, waiting. She starts the car, drives home, alone. The night shift ends. The morning shift begins. The hospital moves on. And Margaret Lawson remains invisible. The automatic doors hiss open at 3:19 in the morning. A gurney slams through. Paramedics flank both sides, compressions ongoing. The patient is a woman, mid-40s, skin the color of wet concrete. Blood-soaked towels wrapped around her abdomen. The lead paramedic shouts over the noise. GSW to the lower left quadrant. Entry only, no exit. She coded twice en route. We got her back. Pressure's tanking. Dr. Pembroke snaps gloves on, moving fast. Get her on the table. 2 units O-neg, now. Jessica, get a central line in. The room erupts. Controlled chaos. Voices overlap. Machines beep. The crash cart rolls into position. Margaret stands in the corner, holding a tray of unused supplies, out of the way, forgotten. She watches. Her eyes track the woman's chest. Shallow rises, irregular. The monitor spikes erratically. Heart rate 142. Blood pressure 68/40. Pembroke works fast. Barking orders. Jessica struggles with the line, veins collapsing, hands shaking just slightly. Margaret's eyes do not move from the patient, not the monitor. The patient, the way her fingers twitch, the micro shudder in her diaphragm, the angle of her jaw. Something shifts in Margaret's expression. A flicker, a memory, a dirt road, night, headlights cutting through dust. A voice, male, calm, military cadence. Lawson, talk to me. Is she viable? Hands pressing gauze into a wound. Younger hands, steadier hands. A woman's face, eyes half open, lip trembling. She's in shock but responsive. Pulse is threadbare. If we don't move now, she's gone. Margaret blinks. Her hand tightens on the tray. The memory dissolves. Jessica finally gets the line in. Pembroke preps the ultrasound probe. Free fluid in the abdomen. She's bleeding out. We need surgery 5 minutes ago. He looks up. Where the hell is the OR team? A nurse calls from the hall. Still prepping from the last case. ETA 4 minutes. Pembroke's jaw tightens. She doesn't have 4 minutes. Silence. The monitors scream. Heart rate 158. Blood pressure 62/38. Margaret sets the tray down. Soundless. Steps forward. Doctor. Pembroke does not turn. You need to pack the wound and get her on pressors. Now. He glances back. Irritation flashing. I'm aware of the protocol, Margaret. It's not protocol. It's triage. She won't make it to the OR without pressure support. Jessica stares. Pembroke hesitates, then nods. Sharp. Fine. Norepinephrine, start at 0.1 mics per kilo per minute. Margaret is already moving. She pulls the vial, draws the dose, primes the line. No hesitation. No second guessing. Her hands are a blur of economy. 15 seconds. She connects the line to the IV port. Infusing. The monitor stutters, then stabilizes. Blood pressure 74/42. 81/48. 88/52. Pembroke stares at the screen, then at Margaret. How did you know the exact? Lucky guess. She steps back, returns to the corner. He does not ask again. The OR team arrives. The patient is wheeled out, stable, alive. The trauma bay empties. Margaret stands alone in the hallway, eyes closed. Her left hand rests on her right wrist again. That same unconscious motion. She exhales, slow, controlled, counts backward from 10. An old habit. Darkness. The sound of rotors overhead. Dust in the air. A hand grips her wrist, tight, pulling her back. Lawson, stand down. That's an order. There are still 3 inside. The building is coming down. You go in, you don't come out. Margaret opens her eyes. The hallway is quiet. She pushes off the wall, keeps walking. In the break room, Jessica sits across from Kyle Harmon, 40 years old, ex-Army medic, now a paramedic supervisor, broad-shouldered, tattooed, calm in the way only veterans are. I'm telling you it was weird, Jessica says. She just knew, like she'd done it 1,000 times. Kyle sips his coffee. Maybe she has. She's a volunteer nurse. She does med carts and linen changes. Kyle does not answer, but his eyes narrow, just slightly. Margaret walks to the supply room, opens a drawer, pulls out a small battered, tattered notebook, flips to a page near the back. Handwritten, neat, dated, Camp Leatherneck, 2009. Beneath it, a list of names. Some are crossed out. She stares at the page for 5 seconds, then closes the notebook, puts it back, locks the drawer. Kyle stands in the hallway outside the trauma day, arms crossed, watching Margaret through the window as she restocks supplies. He has seen that rhythm before, that efficiency, that precision. Jessica walks up beside him. You know her? Kyle does not answer immediately. Maybe. What does that mean? He shakes his head. Nothing. Just a feeling. Jessica frowns. She did something tonight that I've never seen a civilian do. Not that fast. Not that clean. Kyle's jaw tightens. What did she give the patient? Norepinephrine. Pressors. Standard stuff. But she didn't hesitate. Didn't check the dosage. Didn't second guess. Just drew it and gave it like she'd done it under fire. Kyle's expression shifts. Under fire. Jessica nods. Yeah, exactly like that. Kyle pulls out his phone, opens a search browser, types, Margaret Lawson, military service record, no results. He tries again. M. Lawson, Navy corpsman, nothing. Lawson, USMC medical, still nothing. He sets the phone down, rubs his jaw, thinks. Margaret finishes restocking, locks the cabinet, walks toward the exit. Kyle steps into her path. Margaret, she stops does not turn. That was textbook, what you did in there. I've been doing this a long time. Not that long, not for that kind of response. She turns to face him. Her expression is neutral, controlled. Is there something you need, Kyle? He studies her, veteran to veteran. You move like someone who's been in the field. I've worked in hospitals for 30 years. That's not what I mean. Silence. Margaret's breathing slows. Her hand moves to her wrist, touches the scar. Kyle sees it. Where did you serve? I didn't. You're lying. Her jaw tightens. I need to go. She walks past him. Kyle watches her leave, then pulls out his phone again, scrolls to a contact. SGT Davies. USMC retired. Presses call. It rings twice. Harmon, it's 4 a.m. I need you to pull a name for me, quietly. Silence on the line. Go ahead. Margaret Lawson, Navy corpsman, Marine attachment, served somewhere between 2008 and 2012, maybe longer. Another pause. Why are you asking? Because I just watched her treat a trauma patient like she was back in a field hospital under mortar fire. Longer silence. Where are you? St. Mercy, Trauma Center. I'll call you back. The line goes dead. Margaret sits in her car in the parking lot, engine off, hands on the wheel. She stares at the hospital. The lights glow in the dark. She closes her eyes, counts backward from 10. When she opens them, nothing has changed. But something has shifted. Someone is watching now. Someone knows. The doors explode open at 4:13. 3 gurneys. Sirens wailing outside. Red and blue light slicing through the pre-dawn dark. The lead paramedic, a woman in her 30s, blood on her gloves, shouts over the chaos. Multi-vehicle pileup on the I-92 overpass. 3 criticals, all showing acute respiratory distress. Stress, unknown exposure, hazmat still on scene. Pembroke is already moving, pulling on a gown. Respiratory distress? Chemical? Biological? Unknown. They were all in the same vehicle. Symptoms started 2 minutes post-extraction. Coughing, cyanosis, altered mental status. The gurneys roll in. Patient 1, male, 30s, gasping, lips blue. Patient 2, female, 40s, seizing intermittently. Patient 3, male, 50s, unconscious, agonal breathing. Jessica's voice cracks. Jesus, what the hell were they exposed to? Pembroke snaps. I don't know. Get them into isolation. Full PPE. Now. Chaos erupts. Pembroke moves to patient 1. Jessica takes patient 2. 2 residents handle patient 3. Monitors spike. Patient 1. Heart rate 178. Oxygen saturation 81%. Patient 2. Seizing. Unresponsive. Patient 3. Heart rate 52. Bradycardic. Apneic. Pembroke barks orders. Start high-flow oxygen on 1. Get an IV in 2. Intubate 3. Jessica fumbles with the line on patient 2. Hands shaking. I can't get a vein. Then go IO. We don't have time. The resident on patient 3 struggles with the laryngoscope. I can't visualize the cords. Too much secretion. Suction. Then try again. Patient 1 starts thrashing. Can't breathe. Pembroke grabs his shoulder. Hold him down. Jessica, sedate him. With what? We don't even know what's in his system. Midazolam, 2 mics. Just do it. She hesitates. Margaret stands in the doorway, watching. Her eyes move fast, patient to patient, monitor to monitor. She sees it, the pattern. Pupils constricted, excessive salivation. Bradycardia in patient 3, tachycardia in patient 1, seizure activity in patient 2. Her jaw tightens, a tent, desert heat, a man convulsing on a cot. Organophosphate exposure, nerve agent. You've got 60 seconds before he stops breathing. Atropine? Already in. Now you give him something to stop the seizing or he's dead. Margaret blinks, moves. She steps inside, calm, quiet, invisible. No one notices. She goes to the med cart, pulls 3 vials, atropine, pralidoxime, diazepam. Her hands move like water. 0 seconds. Margaret draws atropine into a syringe. 2 milligrams. 4 seconds. She moves to patient 3, finds the IV port, injects. Pembroke glances up. Margaret, what are you? Trust me. 11 seconds. She draws pralidoxime, 1 gram. 18 seconds. Moves to patient 1. He's still thrashing. She grabs his arm. Firm. Controlled. Hold still. He does. She injects. 27 seconds. She draws diazepam, 5 milligrams. 34 seconds. Moves to patient 2. Still seizing. Margaret doesn't flinch. She finds the vein. Injects. 41 seconds. She steps back. Silence. The room holds its breath. Then, patient 3's monitor beeps. Heart rate 52, 61, 74. Breathing resumes. Patient 1 stops thrashing. Oxygen saturation 81%, 86, 91. Patient 2's seizure stops. Her eyes flutter. Pembroke stares at the monitors, then at Margaret. What did you just do? Cholinergic crisis. Organophosphate poisoning. They were exposed to pesticide or nerve agent. Atropine reverses the muscarinic effects. Pralidoxime reactivates the cholinesterase. Diazepam stops the CNS excitation. Dead silence. Jessica's voice is barely a whisper. How the hell did you know that? Margaret does not answer. She sets the syringes down, turns to leave. Kyle Harmon stands in the doorway. He has been watching. His face is stone. Margaret walks past him. He does not move. But his eyes follow her. His right hand moves, unconscious, touches his chest, where a name tape used to be, where a flag used to fly. He knows that sequence. He has seen it before. In the hallway, Margaret leans against the wall, eyes closed, hand on her wrist. She exhales, counts backward from 10. Her phone buzzes in her pocket. She ignores it. Kyle pulls out his phone, opens the text from Davies. Found her. You need to sit down for this. He scrolls, reads. His expression shifts. Disbelief. Respect. Master Chief Petty Officer Margaret Ann Lawson, USN retired, Navy Cross recipient. 22 years active. Fleet Marine Force corpsman, served with MARSOC. Classified deployments. Discharged 2014. She's not just a medic, Harmon. She's the medic. Kyle exhales, looks down the hallway. She is already gone. Pembroke stands in the trauma bay, staring at the 3 patients. All stable now, all alive. Jessica walks up beside him. She saved them. Pembroke nods. In 90 seconds. How? He shakes his head. I don't know, but I'm going to find out. In the break room, Kyle sits alone, phone in hand, staring at the text. Master Chief, Navy Cross, MARSOC. He sets the phone down, rubs his face. He has worked with civilians for years, trained paramedics, taught protocols. But what he just saw was not civilian medicine. That was combat medicine, field triage under fire, and Margaret Lawson just executed it like she never left the war. Margaret sits in her car, engine running, hands on the wheel. She stares at the hospital in the rear-view mirror. The lights, the chaos, the lives she just saved. She did not want this. She did not want to be seen. But now someone knows, and once one person knows, others will follow. She closes her eyes, counts backward from 10. When she opens them, the hospital is still there, glowing, waiting. She puts the car in drive, but she does not leave, not yet. Because somewhere inside that building, 3 people are alive, and that is all that matters. She turns off the engine, gets out, walks back inside. The night is not over, and neither is she. The fluorescent lights hum, the trauma bays have quieted, patients stabilized. Hazmat cleared the scene. Confirmed organophosphate exposure from a ruptured pesticide tank in the vehicle. The news plays on mute in the corner. Coffee brews. Voices murmur. Margaret refills the medication cart. Methodical, invisible. In the hallway, Pembroke and Jessica stand near the nurse's station. "I've been practicing emergency medicine for 6 years," Pembroke says. "I didn't even consider nerve agent poisoning." Jessica shakes her head. "Neither did I, but she just walked in and fixed it. In 90 seconds. Where the hell does a volunteer nurse learn field treatment for organophosphate exposure?" Jessica glances toward the supply room. "I don't know, but Kyle was watching. And he looked like he'd seen a ghost." In the break room, Kyle sits alone at the table, staring at his phone. On the screen, a database query. Margaret Lawson, U.S. military service record. No results. He tries again. M. Lawson, Navy corpsman. Nothing. Lawson, USNC medical. Still nothing. He sets the phone down, rubs his jaw, thinks. A forward operating base. Afghanistan. 2011. Kyle, younger, in desert fatigues, stands outside a medical tent. Inside, a figure moves with precision. Navy corpsman, female, mid-30s. She's sedating 3 casualties in rapid succession. Same sequence, atropine, pralidoxime, diazepam. Same hands, same rhythm. Who the hell is she? That's Lawson, Marine Detachment, best damn combat medic I've ever seen. Kyle's eyes widen. He picks up the phone again, scrolls to a contact. SGT Davies, USMC Ret. Presses call. It rings twice. "Harmon, it's 4 in the morning. I need you to pull a name for me." Quietly. Silence on the line. "Go ahead." Margaret Lawson, Navy corpsman, Marine attachment, served somewhere between 2008 and 2012, maybe longer. Another pause. "Why are you asking?" "Because I just watched her sedate 3 nerve agent casualties in 90 seconds, like it was muscle memory." Longer silence. "Where are you?" "St. Mercy, Trauma Center." "I'll call you back." The line goes dead. Margaret wipes down the crash cart in Trauma Bay 1. The room is empty now. Clean. Quiet. She moves without thinking, but her hands pause on the handle of a drawer. Inside, atropine vials. She closes it, breathes. In the hallway, Kyle walks toward her, slow, deliberate. His boots make no sound. "Margaret." She stops, does not turn. That was a textbook field response to a cholinergic crisis. Down to the dosage, down to the sequence. I read a lot. Not from a book. Silence. She turns to face him. Her expression is neutral, controlled. "Is there something you need, Kyle?" He studies her. Veteran to veteran. Camp Leatherneck, Helmand Province, 2011. Her face does not change, but her breathing does, just slightly. "I was Army medevac. You were embedded with 2nd Battalion, 7th Marines. You ran triage out of a tent, with no roof and a generator that died every 6 hours." "You're mistaken." "No, I'm not." He steps closer. "You saved a kid, 18, maybe 19. Got hit by an IED, shrapnel in his chest, collapsed lung. You cracked his ribs with your hands and held his lung open until we got him on the bird." Her jaw tightens. "His name was Torres. PFC, Emmanuel Torres." Margaret's eyes flicker, just once. "That's a common name." "He's Jessica's older brother." Silence. The hallway hums. "He's alive because of you." She doesn't know, but I do. Margaret's hands are steady, but her voice, just barely, isn't. "I'm not who you think I am." "Yeah, you are." He leans in, drops his voice. "And if I figured it out, someone else will too." At the nurse's station, Jessica looks up from her tablet, sees Kyle and Margaret in the hallway, sees the way they're standing, the way Margaret's shoulders are set. She turns to Pembroke. "What's going on?" Pembroke follows her gaze. "I don't know, but I'm about to find out." He starts walking toward them. Kyle's phone buzzes. He glances at the screen. Text from Davies. Found her. You need to sit down for this. He looks back at Margaret. They're going to want to know who you are. I'm a nurse. You're a legend. She does not respond. Pembroke arrives. Is there a problem here? Kyle does not break eye contact with Margaret. No problem, Doc. Just catching up with an old friend. Margaret? She finally looks away. It's nothing, excuse me. She walks past them both. Calm, controlled, gone. Kyle opens the text from Davies. Scrolls, reads. His expression shifts. Disbelief, respect. Master Chief Petty Officer Margaret Ann Lawson, USN retired. Navy Cross recipient, 22 years active. Fleet Marine Force Corpsman, served with MARSOC. Classified deployments. Discharged 2014. She's not just a medic, Harmon. She's the medic. Kyle exhales, looks down the hallway. She is already gone. Jessica walks up beside him. What was that about? Kyle hesitates, then shows her the phone. Jessica reads. Her face goes pale. Master Chief? Navy Cross? MARSOC? Kyle nods. She's the real deal. Jessica stares at the text. And she's been here for 3 years, doing med carts. Because she wanted to disappear. Jessica's voice is barely a whisper. My brother, Emmanuel, he was in Helmand, 2011. He almost died. Kyle meets her eyes. She saved him. I was there. I saw it. Jessica's hands shake. She saved my brother. And I've been treating her like she's useless. Kyle puts a hand on her shoulder. You didn't know. I should have. Pembroke stands behind them. What the hell is going on? Kyle turns the phone toward him. Pembroke reads. His expression shifts from confusion to shock. She's military? Was. Retired. Decorated. One of the best combat medics the Navy ever had. Pembroke stares at the screen. And she's been working here as a volunteer. Because she didn't want anyone to know. Jessica wipes her eyes. We need to find her. Kyle shakes his head. She doesn't want to be found. Not yet. Then what do we do? Kyle looks toward the exit. We wait, and when she's ready, we listen. Margaret sits in her car in the parking lot, engine off, hands on the wheel. She knows they know. And there is no going back now. She closes her eyes, counts backward from 10. When she opens them, the sun is starting to rise. The night is over, but the reckoning has just begun. The shift is ending. Nurses peel off gloves. Residents sign charts. The ambulance bay is quiet. The sun has not risen yet, but the sky is starting to pale. Margaret stands at the medication cart, finishing her last restock. She moves like always, invisible, until the black SUV pulls up. No lights, no sirens, tinted windows, government plates. It stops directly in front of the entrance. 2 men step out. One in his late 40s, suit. Earpiece, federal posture. The other in his early 50s, Navy service uniform, ribbons across his chest. Officer. They walk inside. At the reception desk, the woman looks up. Can I help you? The officer speaks, calm, authoritative. We're looking for Margaret Lawson. The receptionist hesitates. Is she in trouble? No, ma'am. We just need to speak with her. She's still on shift. I think she's in the back. I can page. That won't be necessary. We'll find her. They walk past. In the hallway, Margaret pushes the cart toward the supply room. She hears boots. Not sneakers, not clogs. Boots. Polished, rhythmic. She stops. Her hand tightens on the cart handle. She does not turn around. Master Chief. She freezes. The word hits like a shockwave. Master Chief. No one has called her that in 10 years. She turns, slowly. The officer stands 10 feet away. Master Chief Petty Officer Margaret Ann Lawson, United States Navy, retired. Her voice is steady, barely. I'm not active duty. No, ma'am, you're not, but you're still a Marine. Silence. What do you want? The officer steps closer. My name is Captain Raymond Hale, Naval Special Warfare Command. This is Agent Dorsey, Homeland Security. Agent Dorsey nods. We're here because 30 minutes ago, a hazmat decontamination team confirmed that the pesticide involved in tonight's incident was laced with a trace amount of VX nerve agent. Margaret's expression does not change, but her breathing slows. The exposure was accidental. The truck was transporting black market chemicals. But the compound you neutralized tonight? It's not something a civilian would recognize or know how to treat. I got lucky. No, Master Chief. You got trained. He pulls a tablet from his jacket, turns it toward her. On screen, a service photo. Younger, uniform, medals, Navy Cross. You served with MARSOC, 3 deployments, Fallujah, Helmand, classified insertion in Syria. You were the senior medical officer for a direct action platoon. You have more combat saves than most surgeons have patients. That was a long time ago. Muscle memory doesn't forget. She says nothing. The sequence you used tonight, atropine, pralidoxime, diazepam. That's CBRN protocol, chemical, biological, radiological, nuclear. It's taught to Tier 1 medics and Special Operations corpsmen. He pauses. You didn't hesitate. You didn't second guess. You treated 3 patients in 90 seconds like you were back in a field hospital under fire. I did my job. Yes, ma'am, you did. And because of that, 3 people are alive. Silence. Agent Dorsey speaks. We're not here to expose you, Miss Lawson. We're here to thank you, and to ask why a decorated Master Chief with a Navy Cross is working night shifts restocking medical carts. Margaret's jaw tightens. Because I wanted to disappear. Why? Because I was tired of war. At the nurses' station, Jessica, Pembroke, and Kyle stand frozen, watching from a distance. Jessica's voice is barely a whisper. Who the hell is she? Kyle does not answer. He already knows. In the hallway, Captain Hale continues. Master Chief, I understand the need for privacy, but the people in this hospital deserve to know who saved those lives tonight, and they deserve to know it wasn't luck. They don't need to know. With respect, ma'am, yes they do. He steps aside. Behind him, the hallway is no longer empty. Jessica, Pembroke, Kyle, and behind them, more staff, residents, nurses, techs, all watching, all silent. Margaret's hands curl into fists. Captain, I'm asking you to leave. I will, but not before I do this. He stands at attention, raises his right hand, salutes, sharp, crisp, military perfect. On behalf of the United States Navy and the men and women you served with, thank you, Master Chief. Margaret stares. Her throat tightens. Agent Dorsey salutes as well. Then Kyle steps forward. He salutes. Thank you, Master Chief. Jessica does not understand, but she feels it. She places her hand over her heart. Pembroke does the same. One by one, a staff follows. Hands over hearts. Silence. Respect. Margaret's eyes glisten. She does not cry, but she feels it. Every second of the last 10 years, every name she could not save, every night she tried to forget. She lifts her right hand, returns the salute. Her voice is quiet. Hooyah. The word echoes. Captain Hale lowers his hand. You served with honor, Master Chief, and you're still serving. He hands her a card. If you ever want to come back, or if you just want to talk, call me. Margaret takes the card, does not look at it. Hale nods to Dorsey. They turn and leave. The hallway remains silent. Margaret stands alone, surrounded by people. But for the first time in a decade, she is seen. Jessica steps forward, tears in her eyes. My brother, Emmanuel Torres, Helmand Province, 2011. Margaret's face softens. I remember. Jessica's voice breaks. You saved his life. He saved his own. I just bought him time. He's alive because of you. Margaret nods. Jessica extends her hand. Thank you. Margaret takes it. He was brave. You should be proud. I am, because of you. Pembroke steps forward. Master Chief, I owe you an apology. I underestimated you, and I dismissed you. You didn't know. That's not an excuse. He pauses. I'd be honored if you'd consider staying, not as support staff, as a clinical instructor, trauma response, CBRN protocol, whatever you're willing to teach. Margaret looks at him. Then at the staff around her. I'm not a teacher. Kyle speaks from behind her. You already are. She turns. He's holding his phone. On the screen, a message from Davies. She trained half the corpsmen in 3rd Marine Division. She's a legend. Margaret exhales. I just want to help. Kyle smiles. Then stay and teach us how. Margaret looks around. At the faces, at the respect, at the chance to be more than invisible. She nods. I'll think about it. But they all know. She has already decided. The conference room is small, fluorescent, a table, 4 chairs. Margaret sits across from Captain Hale and Agent Dorsey. She has not taken off her scrubs. Her name tag still reads, Volunteer Support Staff. You don't have to talk to us, Master Chief, but if you do, it stays in this room. Margaret looks at him, then at the door. It's closed. She exhales. What do you want to know? Why you left? Silence. I didn't leave. I was discharged. Honorably. With full benefits, and a Navy Cross. That doesn't mean it was my choice. Dorsey leans forward. The records say you requested separation, medical retirement, psychological. Margaret's hands rest on the table, steady, but her knuckles are white. The records say a lot of things. What do you say? She is quiet for a long time. Then she speaks. I say I couldn't do it anymore. A field hospital, Helmand Province, 2012, night. Dust in the air. The sound of rotors overhead. Generators roaring. Margaret, younger, in desert fatigues, works over a Marine. Early 20s, shrapnel wounds, bleeding out. Her hands move fast, packing the wound, starting the line, calling for blood. Stay with me, Lance Corporal. You hear me? Stay with me. The Marine's eyes flutter. Doc. I'm here. I'm right here. His hand grips hers, tight. Then the monitor flatlines. No. No, no, no. She starts compressions. Come on, come on. 30 seconds. 1 minute. 2. A hand on her shoulder. Lawson, he's gone. She does not stop. He's not gone. Master Chief, he's gone. She stops, looks down. The Marine's eyes are open, empty. Her hands are covered in his blood. Margaret's voice is quiet. His name was Corporal Nathaniel Reeves. He was 22. He'd been in country for 6 weeks. I'm sorry. He wasn't the first, and he wasn't the last. She looks at Hale. I lost count after 60. Silence. Dorsey speaks softly. You saved more than you lost. That doesn't make the ones I lost weigh any less. She leans back. I did 3 tours. I treated gunshot wounds, IED trauma, burns, amputations, chemical exposure. I put 18-year-olds back together with duct tape and prayer. I held their hands while they died and told them they were going home. Her voice cracks. Just slightly. And when I came back, I couldn't sleep. I couldn't eat. I couldn't close my eyes without seeing their faces. PTSD. They called it that. I called it the cost of doing business. Dorsey nods. So you left. I didn't leave. I ran. She looks down at her hands. I came here because I thought if I could just do something normal, something quiet, something that didn't involve blood and death and... She stops. I thought I could forget. Did you? She shakes her head. No, but I tried. Outside the conference room, Jessica stands near the door. She cannot hear the words, but she can hear the tone. She looks at Kyle, standing beside her. She saved my brother. Kyle nods. And I treated her like she didn't matter. You didn't know. I should have. Inside, Hale leans forward. Master Chief, I'm going to be direct. The Navy wants you back. Margaret looks up. Not active duty, but as a consultant. Training corpsman. Teaching CBRN response. Your experience is irreplaceable. I'm 72. And you just saved 3 lives in 90 seconds. Age is irrelevant. I'm done with the military. Then stay here, but stop hiding. Silence. You're still saving lives, Master Chief. You never stopped. The only difference is now people know. I didn't want them to know. Why? Because I don't want to be a hero. You're not a hero. You're a professional. And the people in this hospital need to see that. She does not answer. Hale stands. Thank you for your time, Master Chief. And for your service. He salutes again. She does not return it this time. He leaves. Dorsey lingers. For what it's worth, my brother was a Marine. Helmand, 2011. He came home because someone like you kept him alive long enough to get on a bird. What's his name? Sergeant Eric Dorsey. Margaret's eyes widen, just slightly. I remember him. He remembers you too. He nods, leaves. Margaret sits alone. Her hands are shaking now. She presses them flat against the table, breathes, counts backward from 10. The same field hospital, a different face. Sergeant Eric Dorsey, unconscious, chest wound. Margaret's hands, younger, steadier, holding his lung open. You're not dying today, Sergeant. Not on my watch. Margaret opens her eyes, whispers, not on my watch. Jessica enters the room. Margaret looks up. And sorry to interrupt. You're not. Jessica sits down across from her. I need to say something. Margaret waits. My brother, Emmanuel, he told me about you. Years ago, he said there was a Navy corpsman who wouldn't let him die, who told him he was going home, even when he didn't believe it. Margaret's face softens. He said her name was Lawson, and that she had the calmest voice he'd ever heard. Jessica's eyes fill with tears. That was you. Margaret nods. He's alive. He's married. He has 2 kids. I'm glad. Jessica's voice breaks. And I spent the last 6 months treating you like you were invisible. You didn't know. I should have treated you with respect anyway. Silence. Jessica extends her hand. Thank you, for my brother, and for showing me what real competence looks like. Margaret takes her hand. He was brave. You should be proud. I am, because of you. Jessica stands, pauses at the door. Will you stay? Margaret looks at her, then at her hands, at the scars, at the years. I don't know yet. Jessica nods. I hope you do. She leaves. Margaret sits alone in the conference room. The fluorescent lights hum. She closes her eyes, and for the first time in 10 years, she does not count backward. She just breathes and lets herself feel the weight of the past, the possibility of the future, and the quiet, undeniable truth that she is still needed, still capable, still here. She opens her eyes, stands, walks to the door, opens it, steps into the light. The morning shift arrives, coffee brews, voices overlap, charts exchange hands. Margaret walks through the corridor toward the staff exit, head down, quiet, like always. But this time, Jessica steps into her path. Margaret, wait. Margaret stops. I need to say something. You don't owe me. Yes. I do. Silence. Jessica's voice cracks. I treated you like you didn't belong here, like you were in the way. And the whole time, you were the most qualified person in this building. Margaret shakes her head. I wasn't trying to prove anything. I know. That's what makes it worse. Jessica wipes her eyes. You saved my brother. You saved 3 people last night. And you did it without asking for recognition, without needing it. She pauses. I'm sorry. Margaret's face softens. You didn't know. I should have treated you with respect anyway. Margaret nods. We all have things to learn. Jessica smiles through her tears. Will you teach me? Margaret looks at her, then nods. If you're willing to listen, I am. At the nurse's station, Pembroke intercepts Margaret. Master Chief, she stops. I owe you an apology. Logie, I underestimated you, and worse, I dismissed you. You didn't know. That's not an excuse. He pauses. I've been practicing medicine for 6 years, and last night, I learned more from watching you work than I did in all of my residency. You did fine, doctor. No, I froze. You didn't. He looks her in the eye. I'd be honored if you'd consider staying, not as support staff, as a clinical instructor. Trauma response, CBRN protocol, mass casualty triage. Whatever you're willing to teach. I'm not a teacher. You already are. Margaret looks past him at the staff gathered nearby, watching, listening. Kyle stands among them. He nods. You've been teaching us since the moment you walked in. We just weren't paying attention. Margaret exhales. I'll think about it. Pembroke smiles. That's all I ask. Later that morning, Margaret sits in the office of Hospital Administrator Diane Carroll, 58, sharp, no nonsense. Carroll sits across from her. I'll be direct, Ms. Lawson. The board received a call this morning from Naval Special Warfare Command. They informed us that we've had a decorated combat medic working in our facility for 3 years, and we had no idea. I didn't advertise it. Clearly, she leans forward. They also told us what you did last night, and how you did it. I did what anyone with the training would do. No, you did what no one else can do. Silence. Carol slides a folder across the desk. I'm offering you a position. Full-time, trauma clinical specialist. You'll train our staff in advanced emergency response, triage, chemical exposure, mass casualty protocols, crisis management. I'm 72. And you just saved 3 lives in 90 seconds. I don't care if you're 92. Margaret looks at the folder, does not open it. I'm not sure I'm ready for that. You've been ready for 20 years. Carol's voice softens. Margaret, this hospital needs you. Not as a volunteer, not as someone in the background, as a leader. Margaret's hands rest on the table. I came here to disappear. I know, but you didn't. You can't. Because the moment someone needs help, you step forward. She pauses. That's not something you can turn off, and we don't want you to. Margaret looks at her. What if I fail? You won't. But even if you do, you'll fail forward. And you'll teach us how to do the same. Margaret picks up the folder, opens it. Inside, a contract, a job description, a salary far beyond what she expected, and at the top, a title. Director of Trauma Education and Emergency Preparedness. She stares at it. This is too much. It's exactly what you're worth. Margaret closes the folder. I need time to think. Carol nods. Take the day, but don't take too long. We need you. 1 week later, the hospital has changed. New protocols are being drafted. Training schedules revised. Staff meetings restructured. And at the center of it all, Margaret Lawson. She stands in a classroom, 20 residents and nurses seated in front of her. On the table, atropine, pralidoxime, diazepam. This is a cholinergic crisis scenario. 3 patients, 90 seconds. You'll work in teams, 1 person per patient. I'll be timing you. A young resident raises her hand. What if we make a mistake? Margaret looks at her. Then you learn from it. That's why we train. So when it's real, you don't freeze. She picks up the atropine vial. This can save a life, but only if you know when to use it, how much to give, and what comes next. She sets it down. Today you're going to practice until you can do it in your sleep, because someday you'll be the one standing between a patient and death. She looks around the room. Questions? Silence. Respect. She nods. Good. Let's begin. The teams move to their stations. Margaret watches, silent, observant. She corrects technique, adjusts dosages, reinforces timing. Her voice is calm, firm, clear. The voice of someone who has done this 1,000 times and survived. By the end of the session, every team has completed the sequence, some faster than others, some with mistakes, but all with focus. Margaret stands at the front of the room. You did well, but this was controlled. No chaos. No blood. No fear. She pauses. Next week, we add pressure, noise, distraction, because that's what the real world looks like. A resident speaks up. How do you stay calm when everything's falling apart? Margaret looks at him. You remember why you're there. Not for yourself. For the person who can't save themselves. She picks up her notebook. That's all that matters. The room is silent. Then, one by one, the staff begins to clap. Margaret does not smile, but she nods. Acknowledgement. Respect. In the hallway, Jessica walks beside her. That was incredible. It was just training. No, it was more than that. Jessica pauses. You gave them confidence, structure, hope. Margaret looks at her. That's what good training does. That's what good leadership does. Margaret does not respond, but something in her expression shifts. Acceptance. Kyle approaches from the other end of the hall. Master Chief, got a minute? Margaret nods. Jessica excuses herself. Kyle and Margaret walk to the atrium. Quiet, empty. I wanted to say thank you. For what? For staying, for teaching, for not giving up on us. Margaret shakes her head. I didn't do it for you. I know, you did it because it's who you are. He pauses. But it still matters. Margaret looks out the window at the city beyond. I spent 10 years trying to forget, trying to be invisible. She turns to him. But you can't run from who you are. Not forever. Kyle smiles. No, ma'am, you can't. He salutes. She returns it. And for the first time in years, it feels right. 18 months later, the hospital has changed. New protocols, new training programs, new faces in the halls. But the rhythm is the same. Monitors beep, gurneys roll, voices call out vitals. Life, death, everything in between. In the training room, Margaret stands at the front of a packed classroom. Residents, nurses, paramedics, EMTs. She is 74 now, hair a little whiter, posture still military straight. On the table in front of her, atropine, pralidoxime, diazepam. Let's run it again. From the top, chemical exposure, 3 patients, 90 seconds. A young resident, Dr. Amin Patel, 28, steps forward, confident, focused. He picks up the first vial. Patient 1, bradycardic, excessive. Excessive salivation, pinpoint pupils. I'm giving atropine, 2 milligrams IV push. Why? To block the muscarinic receptors and reverse the parasympathetic overload. Good. Next. Another resident, Dr. Sarah Kim, 26, moves to the second station. Patient 2, tachycardic, respiratory distress. I'm administering pralidoxime, 1 gram over 2 minutes. And what does that do? Reactivates acetylcholinesterase to restore neuromuscular function. Correct. Last one. Jessica. Now a senior trauma nurse steps up to the third station. Patient 3, seizing, CNS excitation, diazepam, 5 milligrams, slow IV. Dosage. Titrate to effect. Watch for respiratory depression. Exactly. Margaret looks at the clock. 87 seconds. Well done. The class exhales. Margaret allows the smallest smile. But in the field, you won't have a timer. You'll have chaos, fear, blood, and a patient whose life depends on you not freezing. She walks to the front of the room. So we run it again, and again, until it's muscle memory, until you can do it blind, because someday, someone's going to need you to be perfect under pressure. Patel raises his hand. How do you do that, Master Chief? Stay calm when everything's falling apart. Margaret pauses. You remember why you're there, not for the adrenaline, not for the glory, for the person in front of you who can't save themselves. Silence. That's all that matters. In the hospital atrium, a ceremony is underway. Hospital staff, local officials, press cameras. Administrator Harrell stands at a podium. Today, we dedicate the newly established Lawson Center for Combat Trauma and Emergency Medicine, a training facility designed to prepare our medical professionals for the unexpected. Applause. Margaret sits in the front row, uncomfortable in a formal blazer. This center exists because one woman refused to let her experience go to waste. She could have stayed invisible. Instead, she chose to teach, to lead, to serve. Carol looks directly at Margaret. Master Chief Margaret Lawson, would you please stand? Margaret hesitates, then rises. The room erupts in applause. She does not smile, but she nods. Later, Margaret walks alone through the quiet corridor. The ceremonial is over. The crowd has dispersed. She stops in front of a wall, a memorial plaque, in honor of those who serve. Military medical personnel who transition to civilian care. Beneath it, a list of names. And at the top, Master Chief Margaret Lawson, USN retired, Navy Cross recipient. She touches the plaque, lightly. You earned it. She turns. Kyle stands behind her, paramedic uniform, calm as ever. Still trying to disappear? Old habits. He steps beside her. You know, when I first saw you, I thought you were just another volunteer trying to stay busy. I was. No. You were a Master Chief pretending to be a volunteer. She smiles. Faint but real. Maybe. You saved my life once. Ramadi, 2008, IED. You pulled me out of a burning Humvee. Margaret looks at him. Harmon, Sergeant Kyle Harmon. I didn't think you'd remember. I remember all of you. Silence. Thank you. You already thanked me. Not enough. On the hospital roof, Margaret stands alone, looking. Ning out over the city. The sun is setting, orange and gold. She pulls a small, worn notebook from her pocket, opens it, flips through pages of names, some crossed out, some circled. She adds new ones. Emmanuel Torres, alive. Jessica's brother. Eric Dorsey, alive. Agent Dorsey's brother. Kyle Harmon, alive. Paramedic. She closes the notebook, holds it to her chest. A field hospital. The faces. The chaos, the blood. I can't save them all. The same faces, older now. Alive, living. But I saved enough. Margaret exhales, looks out at the city, at the hospital behind her, at the life she built from the ashes of war. She whispers, not on my watch. She turns, walks back inside, back to the work, back to the students, back to the lives she will keep saving, because that is what she does. Not because she is a hero, because she is a professional. And she never stopped serving. Margaret teaching, residents practicing, Jessica running a trauma, Patel saving a life, Kim leading a code, the Lawson Center bustling with students, equipment, Purpose. A letter on Margaret's desk from the Navy. An invitation to speak at the Naval Medical Center. Margaret at home, looking at a photograph. Younger, in uniform, surrounded by Marines. She sets it down, picks up her keys, heads back to work. The screen fades to black. Text appears. Master Chief Margaret Lawson served 22 years in the U.S. Navy as a Fleet Marine Force corpsman. She is credited with over 200 combat saves. She now trains the next generation of trauma professionals. She never stopped serving. The sound of a hospital, monitors beeping, voices steady, life continuing. In her office, Margaret sits at her desk. A knock at the door. Come in. Jessica enters, holding a folder. Master Chief, we just got word. There's a mass casualty drill scheduled for next month. They want you to lead it. Margaret looks up. How many participants? 50. Multi-agency. Fire, police, EMS, hospital staff. Margaret nods. We'll be ready. Jessica smiles. I know we will. She turns to leave, then stops. Margaret? Yes. Thank you for everything. Margaret meets her eyes. Thank you for listening. Jessica leaves. Margaret looks down at the folder on her desk, opens it. Inside, a training plan, scenarios, objectives, timelines. She picks up a pen, begins to write. Because the work is never finished, the need is never gone. And as long as she can stand, as long as she can teach, as long as she can serve, she will. Not for recognition, not for glory, but for the person who cannot save themselves, for the student who needs guidance, for the life that hangs in the balance. That is her mission, that is her purpose, and she will carry it until her last breath. Margaret closes the folder, stands, walks to the window. The city stretches out before her. Thousands of lives, thousands of moments, thousands of chances to make a difference. She places her hand on the glass, feels the warmth of the sun, and smiles. Because she is home, not in a place, but in a purpose, and that is enough. The sound of monitors, the hum of the hospital, the rhythm of life continuing. Margaret turns from the window, picks up her notebook, and walks back into the light.